My name is Shelly Fritz. I'm an avid user of physical therapy as part of my treatment plan for joint, muscle, and nerve pain from rheumatoid arthritis, fibromyalgia, and osteoarthritis in my hand and spine. And today I'm talking with Dr. Susan Knoll. Dr. Knoll received her doctorate from the University of Utah in 2004. She currently practices in San Francisco and specializes in outpatient orthopedic physical therapy. Welcome, Dr. Knoll.
Thank you so much for having me. I'm excited to chat with you.
Thank you for taking time to talk with me today about physical therapy and internet-based exercise. Knee osteoarthritis is a chronic condition that's characterized by knee joint pain and stiffness. To address these symptoms, appropriate exercise is often recommended as treatment. However, physical therapy, a common method of providing exercise support, is not universally accessible and can be expensive. A 2018 study, Physical Therapy versus Internet-Based Exercise Training for Patients with Knee Osteoarthritis, Results of a Randomized Controlled Trial, aimed to assist patients in receiving guidance and instruction for suitable exercises to manage knee osteoarthritis. The research team divided patients into 3 groups. The first group received traditional physical therapy sessions. The second group had access to a website that provided instructions for knee exercises and facilitated tracking of exercise progress, while the third group did not receive any treatment. Let's talk today about the study and how physical therapy and exercise benefit people with various forms of arthritis. What are the main takeaways from this study, and how can understanding this research be useful for patients?
Main takeaways of this study are that I would say that the group with physical therapy had greater both primary and secondary outcomes in physical function. The physical therapy group that was able to do in-person PT reported more physical activity and stretching, performed better on physical ability tests, had a higher satisfaction with sleep, fatigue, and overall life satisfaction, less fatigue, and a higher overall rating of knee symptom improvement. However, the internet-based group also had significant improvements, which is very encouraging for people who don't necessarily always have access to do in-person physical therapy on a regular basis. That group also reported a higher level of weekly stretching, more consistency with exercise, and a higher level of knee symptom improvement in pain. Another takeaway from this study that I think the researchers were looking for was how many visits are beneficial to effect an outcome and change with physical therapy. And I believe they landed on around 6 visits. In my practice, we usually shoot for, I'd say 10 to 12 visits as a good standard starting point for patients to see some change. I mean, it really takes typically 6 to 8 weeks to see positive change in flexibility and muscle strength and functional outcome scores as far as we're concerned from a physical therapy perspective. So I think the research really reflects my experience and what I've found clinically in my own practice.